Yes. I guess I could do a little history of.
Mhm.
So we met at the Pacific Islander Community Health, and then the PI for that study was at the time, professor at California State San Marcos. And because we did want to continue working with her, we're like, let's gain more knowledge on public health. So at least for me, and you could share your piece, but I wanted to gain more research, and then
I also wanted to gain more research, and also our professor that was like the PI for the Pacific Islander Community Health, she was like, wouldn't it be cool if we all still work together? You should come to do the Master of Public Health program where I'm at. So she basically like brought us in and
recruited.
and she took care of us the whole time we were there.
Yeah,
so
she was a
very
great
thankful.
mentor, and she is a great mentor. Shout out to
Dr. Christina Holla.
Yeah.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 55. Hi everyone, Amari Richards here. Thank you all so much for joining me for this episode. Make sure that you subscribe, you leave a like, and you share this with a friend. It greatly helps to get the show in front of a lot more people. If you want to support the Public Health Millennial platform, go to buymeacoffee.com/the PH Millennial, and you can support there. Really happy to be bringing you the show. I connected with these two wonderful ladies online on Instagram maybe a little over a year ago, and I'm just glad to have them on the show to tell their stories. And I think that there's some great insights, especially around like if you're thinking about doing your MPH and which concentration. I love the thought processes that they use to decide on that. They both started, I think it was like nursing, and then switched over to public health type of work. And you'll hear more about that in the show. But thank you all so much for joining, and I appreciate you all. Hope you all enjoy the show. Today we have the duo you may know on Instagram as the Public Health Palette, at the Public Health Palette. The first of the duo works as a program evaluation specialist at UC San Diego Health, and the other is a dissemination and implementation science coordinator at UC San Diego Health. They both attended San Diego State University and got their Bachelors of Science in Public Health, and they both went on to get their Masters of Public Health at California State University, San Marcos. However, they did have different concentrations, which we'll talk about in the interview. If you haven't yet, be sure to follow them on Instagram at the Public Health Palette. We have Jamie Lee Gruspe Pilapil, MPH, and Louielyn Lirio, MPH. Welcome to the show.
Hi. Thank you for having us.
Yeah, my pleasure. I thought you all were going to join from two different places, but it's dope that you all joined from one.
Yeah, well, we actually live by each other too, so yeah.
Oh, okay, that's awesome. And this is the first, I'm gonna just put it out there for everyone. This is the first time I've done my intro and got it correct on the first run through. So I'm very proud of myself right now. So so how have you all been doing and been coping during these times?
Well, we're planning out her wedding.
Yeah. So coordinator by day and then wedding planner by night. So we'll see how it goes.
That's awesome.
Yeah.
Mm-hmm. So her wedding got delayed. It was supposed to be November of 2020, and during that time, California was like fully locked down. So we rescheduled it in July.
So that's happening. Just really glad that things are going back to normal. So we'll see how that goes.
Yeah. So you're all in California, and I think like everything just opened back up. So how are you all feeling about that?
For me, adjusting, I'm like, wow, people have faces.
Yeah, or like, wow, is that lipstick? But yeah, it's definitely a change. My public health brain is like, oh no, but my personal brain is like, oh yay, pre-pandemic. So we'll see how that goes.
And we're like in San Diego, so it looks like half and half people are wearing masks, and some people are like not. So it's like okay. It's like kind of weird going in a grocery store at people not wearing masks.
Mm-hmm.
But
Yeah, I completely.
See how this goes. Hopefully, the cases do not rise up or anything happen in San Diego County.
Yeah, well, I hope so as well. And because I know like San Francisco has like a very high COVID vaccine rate right now. I'm guessing California on the whole is doing a lot better than a lot of other places. So let's hope that that trajectory continues and you all stay safe and everyone around you all stay safe and you get to enjoy your wedding.
I
That's
know.
that's exciting.
Yeah, the like COVID safety rules. So we'll see how that goes.
Yeah, yeah, definitely, definitely. So how do you identify and then tell us about your personal background?
I'm Filipino American. My parents came from the Philippines, and uh, the reason why we came here, my family came here, is just to follow like the American dream and just find more opportunities for like the generations to come. My dad is in the Navy, and then my his family was also in the Navy. My mom's brother was in the Navy, so that's all basically how we came here. And again, my pronouns are she and her.
Yeah. So we are very similar in that boat as well. My parents are in the military, or my dad is in the military. He's from the Navy, born and raised in San Diego. She, her. I know we're both plant moms and dog moms. I'm surprised we're not related, but yeah. So yeah, I guess that's where we joined together because like public health, and we just like want to like share public health information, and just be like a gateway for everyone, especially from that Filipino American background.
Literally, public health basically brought us together.
Yeah.
Like we came from two different times. Like even though we both went to San Diego State, we graduated different years, but miraculously we just like crossed paths, and then we both decided to go to CSU San Marcos for their master in public health, which we'll talk about more later on.
Yeah, okay, that's awesome. That's fascinating, and I'm definitely gonna hold on to like the gateway and how because I'm guessing that's probably like why you all started the public health pilot. But we'll talk about that a little later on. So what does public health mean to you all?
Um, that's a great question. Where to begin? You want to go first?
Well, for me, I just thought like just why I also chose public health because I like how it utilizes like multiple disciplines of like social and health sciences, uh, where it just aims to improve health outcomes and just increase health equity across all populations like through a very collaborative approach. So that's what um, that's how I would define public health and why I was very intrigued like when I first heard it at San Diego State.
Yeah, so I think for my end, it's pretty similar. I think for me, I was into public health because I really like the prevention side of it, especially since I was a nursing assistant. I always like thought about like, oh, what could have been prevented, and then public health was born. I mean, like my interest for public health was born, and then yeah, I think I just find it fascinating how it's more targeted towards a population versus an individual, and how like a population could affect an individual's behavior. So I guess that's the ultimate like start off of why I am into public health.
Okay, okay, that's awesome. So who went to San Diego State University first, or did you all start at the same time?
I went there first.
Okay,
Yeah.
and
So
and when did you hear about public health? Because people like I didn't know about public health until like 4 years ago. So and you knew about it like it seems like a very long time. And this is your calling and your passion.
yeah, so at least for me, the way I heard about public health is that I wasn't meeting their nursing requirements, just because I guess I was focusing my energy in a different realm of health. And so I went to my counselor, and she just mentioned public health, and I was like, oh, like public health. And being an introvert, hearing the word like public, I'm like, oh my gosh, like what? But after diving into it, I was like, oh, this is interesting. So I guess that counselor has really helped me push my interest in that type of like preventative care. So that's how I got into it.
Okay,
And then,
oh,
oh,
you can go ahead. No, you can go ahead, Louielyn.
oh, because it's pretty similar. Like even though we like didn't know each other at all at San Diego State, I also started like pre-nursing with her too. And I didn't learn it until like my second year, and I was also struggling with nursing as well because I thought, well, I want to be in health, so it's either be a doctor or a nurse. And I saw my cousin use public health as a gateway to go into a accelerated nursing program. So that's why I heard about public health, and I thought, okay, if I do public health, I could probably better inform me to become a nurse. But then I realized I didn't want to be a nurse.
And is that the same for you too? Like, did you not want to be a nurse, or was it
Um,
just that the classes were a little too difficult or not fitting for your style of learning, or whatever the case might be?
I think for me, I don't really like to cater to that, oh, it doesn't fit to me.
Hmm.
It just didn't make me as happy as I thought it would. So, but I mean, I respect all the nurses out there doing their hard work, especially during the pandemic.
Mhm.
Especially as my time as a CNA, I can't imagine how stressful and um, complicated things are. But I mean, it's not off the books, but it's not a priority. So,
Yeah, completely understandable, and like I do appreciate and love what nurses do, but I just could not see myself in that role. So yeah, so I definitely resonate with that. So I was just asking about your certificated nursing assistant and working as a nursing assistant, and what was that process like for you getting that, and then as well as like
oh,
I didn't ask if it was like before your public health, and you said yes. So
okay, yeah. So, okay, that was the part that I missed. But yeah, the process was pretty easy. I mean, it was a pretty quick program to get into, but yeah, CNA has really opened my eyes to gaining experience in public health. It definitely has given me that clinical aspect when I look into like research studies that involve like clinical aspects, and seeing how patients feel rather than, well, also including like providers, how they feel. So I think CNA was also a good stepping stone on why I chose to go into public health.
yeah, and I think that makes a lot of sense. Just having, because you know a lot about doctors, about nurses, about PAs, but you don't know about public health professionals. So like going in the health track and starting on and in nursing as or wanting to be a nurse or a doctor, I feel like that's very common in what I hear from people, and then switching over to public health. You also had like a study abroad in Shanghai, China. So what was that about?
Oh yeah. So at San Diego State, we had to like study abroad.
You
Um,
had to.
we had to, yeah. I know Leland
Yeah.
went to,
I went to Italy, so I
yeah.
think any like under any major under the College of Health and Human Services, so any like kines or social work major as well as public health, all had and nutrition, all had to do a study abroad.
Yeah.
So
And
that's
I
pretty
think
cool.
like for our study abroad, it was different, different like goals for each trip. So at least for my trip, it's just basically gaining cultural awareness and understanding like how to approach a different culture's norm. And so I think that's another reason why I went to public health, just because I did not know a specific um, like behavior a certain culture has, and that has really opened my eyes to keeping that into account on how to like do things in public health.
That's awesome, and that's awesome that they make you do a study abroad experience. I feel like that's not something common that you hear people say, and that is in itself like a huge learning experience and just getting to learn the cultural appropriation and well, not cultural appropriation, but the cultural, um, like just learning the cultural norms of different places and getting used to it. I think is something that a lot of people do not get to experience, and that's great that they allow you to do that. And then you were also a peer health educator at Students for Public Health, and then you were an organizational member. So talk about that experience.
Yeah. So at San Diego State University, I really wanted to gain more experience in the health promotion and education route. So I did apply to be a peer health educator under the health promotion and education department. And so I think that has really, I feel like I say this for everything, but obviously like your experience sets your like stepping stone. But I feel like the peer health education program at SCSU has really sparked my interest in health promotion and education, just because it's amazing how much you think someone doesn't know of a certain topic and in health, and how it could really change their behavior and do things that might harm them or even make them more healthier. So I think that's just a fascinating experience that made me enjoy uh, learning about health behavior. So that's interesting.
Okay, and then you had one last experience in undergrad before we get to Llewellyn. You were Strive Health Promotion Intern. So how did you get that, and then what do you do with that
Yeah, so like the study abroad, we did have to do an internship program as well. And so the Strive program at Operation Samahan was fairly focused on Asian American health and understanding the sodium intake of the Asian American population in San Diego. And so, like Shanghai, that has also opened up my eyes in being culturally aware. And because it was Asian American, I think that opportunity has really, again, emphasize what I wanted to do, which was more focused on trying to help underserved communities and getting the resources they need. So that was a great internship experience. So yeah.
one? Yeah, and definitely sounds like a great one. And I feel like all those experiences were kind of fitting in like what you're talking about, like Asian American experience and really being able to understand and like promote better health behaviors in the populations. So now switching over, um, so what was your thought process going into to San Diego State University? And did you start as a Bachelor's of Public Health student?
Yeah, at first, I didn't have the choice to go outside of San Diego for my undergrad, and because like my parents just wanted me closer, and just like for like financial reasons, and I had like the idea of like, oh, I'm just gonna do nursing because either everybody in my family was either in the military or a nurse. So I thought, okay, it's either one of those that I would probably fit in, and then just seeing like pre-nursing and then like how competitive it is, and San Diego State is really one of like the top nursing schools here in California, so everybody was trying to get in, and it was like very difficult, and then I just felt like myself like getting drained, like I really want to help people in health, but I can't get in. And there was like even other nursing schools around the California was very hard to get in. So I was like, what is a way that I could still be part of improving people's health that I don't need to be a nurse necessarily? And then I discovered public health, and then just started reading more into the major. And then once I got like the feel of like the introductory classes and just getting to know like the advisor, that made me really like really like public health. So that's like my journey of getting into a San Diego State.
Okay, okay, that's awesome, and I guess it makes sense that you also went like down the nursing path and switch over to public health, and we public health people are happy that you did that. But I do think there are a lot of skills and things that you do gain from being a nurse or just taking those nursing classes. And my undergrad roommate was actually a pre-nursing student, and yeah, it was stressful. It was like, yeah, I wouldn't want to go through that kind of stress. But regardless, okay. So you were a volunteer in nursing services at San Diego VA Healthcare Systems. Talk about that experience.
So I come from a military family, so the VA serves all the veterans in San Diego County, and um, I just got inspired, like seeing how they would take care of my dad every time I would take him to his appointments. So I was like, ooh, since I want to be a nurse, maybe I should just volunteer here and just gain the experience and also help meet the requirements of like meeting the volunteer experience. And I was working there in like an emergency department as well as the spinal cord injury, and I just liked how the atmosphere was. But later on, I was like, this is very tiring. I don't know if I could be on my feet like 12-hour shifts trying to take care of multiple patients. So it made me like question like if I really wanted to. I don't know who's upstairs, but
Sorry, my
having
dog.
fun.
I know.
Yeah, so it just made being there just really opened my eyes of like how we take care of like veterans and like different healthcare systems because it's like federally funded and then it's like everything is free for the veterans, which is rightfully so since they served their country. But it just really opened my eyes on like a lot of this could have been prevented if they really took care of their soldiers ahead of time during their service. A lot of them have the same chronic pain, like back pain, diabetes, and which you would think like, oh, since they already like super fit, why would they have diabetes? And it made me really understand like a lot of the health disparities that veterans face is even like um, different racial ethnic backgrounds, they're like very underserved as well. So that really opened my eyes there at the VA.
Okay. Yeah, and I do think that that is important. And what is the reason for the diabetes in veterans?
It's really weird that like you think when you see a veteran with like an amputation, you think, oh, that's probably from the war, but it's from diabetes. That's why. And I was like, how was it? It's like if you probably look back when they were first like in the service, it's like nobody taught them to be healthy eating and that they're always on the go. So I feel like it's because they didn't take care of themselves, and then when they left the service, they probably didn't have as access to healthy foods. And a lot of the times people join the military is to like help them financially, so they already like weren't in the best financial um, area. So when they get out, they don't have the same like free services or easy access to healthy options and food.
Yeah,
That's what I feel like. It's just like I don't know how to explain it.
so you said it was like you don't know how to explain it, or do you know how to explain it? It was like a perpetual kind of.
Just like I do, but maybe not the right words. But I just know it's
Mhm.
like seems like a very generational gap of like they're not taken care of, and then they barely getting taken care of when they're like already sick. Because I think a lot of funding for after the service was like cut,
Mhm.
depending on whoever's the president, and yeah, so you could really see like whoever's like from the Vietnam War or like um, World War II, or if they're from like Afghan or Iraq tour. So you could really see the differences of what kind of health disparities of a veteran or recent um, active duty or retired would face after their service.
And that makes sense. And it is very interesting that they don't put enough like funding into the health promotion and I guess protection parts of it and getting like those health behaviors, especially like afterwards, because there is a lot of funding that goes into the military. So it's very interesting there. But I do hope that there are ways to really solve those issues. Um, you're also a volunteer epidemiology support at the Naval Health Research Center. So how do you get into this one?
So I took for one of our public health classes. It was just another like free for all class that like an elective. So it was for the like general HIV and AIDS class, and my professor was working for the Naval Health Research Center for the Department of Defense HIV AIDS prevention program. So it's one of the like a very another federally funded research within the military, and he was one of the principal investigators for that program. And as an extra credit, he says, if you are one of my research assistants, I'll give you extra like 10 for like at least 20 points extra credit, and then experience for if you do at least 20 hours during that whole semester. So I was like, ooh, I want extra credit. So, and also like just get my um, foot in the door to see like how if I would like to be in like a federal agency in public health, and that really opened my eyes as like and also piqued my interest in global health because they go help a lot of um, South African countries as well as around the world just to help combat HIV and AIDS. And they took more of like a global health diplomatic approach of how to teach people with like sexual education as well as providing them the medications and a way just to make sure there's like they have an allyships between the US and the South African countries. So it was very interesting to learn. I wish I could have like joined them traveling, but it was just like remote, and I just like was looking at a lot of their data and like make reports and graphs for them.
Okay, that is dope. That's awesome that you got to work on. And it was a volunteer position that you got to do all of that in.
It was a volunteer position.
That's a pretty intense volunteer position, I would say. I'm gonna advocate that they pay the other volunteers, and they should reimburse you for that, because it seems like that was a lot of work. But that's awesome. And you said that you wanted to get a feel of how it would be in a federal agencies. Did you like that feel, or did you not like that feel?
It's like it had a pros and cons. Like pros that you will for sure always get funded. I mean, you know how in public health, like making sure you have funds really and grants will keep your job. So I like that, and um, there was like a lot of politics. So definitely relied on whoever was the president and where you can allocate, where can you who you could even help first of all. So very dependent on that. So I think just like the politics of how public health should be like served evenly was very difficult to like grasp. And I was like, why can't we help them too? But they're like, we can't because there are like wars going on. And then I'm like, really, diseases do not know borders, like what we saw like with the pandemic. And I was very like intrigued that we really had to rely on who the president was to do our public health service for everyone.
Yeah, I think that's completely fair. That's the same like thing that happened to the CEO of my organization. She was the state health director, and the government changed, and she quit, or she resigned, or whatever the case might be,
Oh, wow.
because she knew that everything that she did was kind of like just gonna be unraveled, and it's like, what's the point?
Yeah.
But that's not to discourage anyone from going into that.
Yeah.
You
Still go for it. Still go for it.
please and thank you. We need you all there. And then you were also undergrad research assistant at the Pacific Islander Community Health.
Yes, so that's how I met Jamie. So for it was like a requirement again for like a public internship, and I was like really rushing to find an internship because it was almost closing, like when I could apply for an internship, and then I just saw it through San Diego State Research Foundation that Pacific Islander Community Health was available, and it really like resonated to me like, oh, it's a the study mission as well as like the topics piqued my interest, and that I really think pick health or Pacific Islander community health really made me choose public health because of the principal investigator and just the community and how they took the community-based participatory research approach of working with the communities rather than just being the helicopter researcher just coming in and out of just taking the data. So it really inspired me to like stay in public health and working with communities.
Yeah, that's awesome, and I'm glad to hear that. Like, I wish I had something similar like that in my undergraduate, but I had biology and like microbiology, and no sort of like community based research, which I think is like a fascinating part of research that a lot of people just don't get to deal with or see at all. And I think if you do get to be part of that, it could be very impactful in like the work that you want to do growing up. And then the last role that you had as an undergraduate student was as at the Department of the Navy Pathways Program student trainee. So what was that about?
So again, it's another like federally like working in the federal agency, and I also want to experience in Navy medicine and to see if I because the Naval Medical Center in San Diego had like even a public health department as well like the nursing services that they did as well the medical. So I chose that so I could be in the middle of the do I want to be a nurse or do I want to pursue public health? and that really helped me choose and like understand like the healthcare system for the active duty military and their families, and like just see how their medical like insurance was very like I wish like everybody had that because it had a lot of easy services for them. They could easily get referrals. They like don't have to wait, and they could easily choose their provider and like receive the same good services consistently, even if they move to a different state. So it was really a good experience to like just see the types of people in the population, the military population, and like their different health outcomes and how the Navy and the military overall treats their patients.
Okay. Yeah, and that is awesome. And I hope we do get to a place where everyone can have that kind of insurance or some sort of insurance where they are able to have that safety net on their life, which is crazy, which there is none here for a lot of people. Um, so then moving on, after this, you all both went on to get your Master's of Public Health at California State University, San Marcos, which is also in San Diego County, which I just learned. Was this I have written here that it was an accelerated program. Did both of you do an accelerated program?
Yes, it was an accelerated program.
And
Yeah.
how did you hear about the accelerated program, first of all? Like, okay, did both of you all know that you wanted to go and get your Master's in Public Health?
Yes. I guess I could do a little history of.
Mhm.
So we met at the Pacific Islander Community Health, and then the PI for that study was a at the time professor at California State San Marcos. And because we did want to continue working with her, we're like, let's gain more knowledge on public health. So at least for me, and you could share your piece, but I wanted to gain more research, and then
I also wanted to gain more research, and also our professor that was like the PI for the Pacific Islander Community Health, she was like, wouldn't it be cool if we all still work together? You should come to do the Master of Public Health program where I'm at. So she basically like brought us in and
recruited.
yeah, and she took care of us the whole time we were there.
Yeah,
So
she was a
very
great
thankful.
mentor, and she is a great mentor. Shout out to
Dr. Christina Holla.
yeah. But yeah, she was a great like stepping stone for our time at the master's program, and was very informative of like how to get started in our master's program. So I think that's like where we really grew and found our interest.
Yeah, and then she's also a Filipino American too. So that was like our like for me at least like a first role model that's not in like typical nursing or doctor. And then she's now the director of the MPH program. So very like goals and a really great mentor and role model that we hope to aspire to.
I know.
Yeah, well, I'm glad that you all met at Pick Health and that you were able to get a mentor and someone to pull you into the MPH program. And I bet she's a great resource up to this day and probably has a lot of great things. Probably helped you all, as you said, she helped you all throughout the entire process, which is dope. So what's the difference between like a regular MPH and the accelerated program? Was it just like a year program?
Yeah, it was like 18 months, right?
Yeah, or 16
Or
months.
16. And
Yeah,
we did not have a summer break.
Yeah, so normally it would be a 2-year normal MPH program, but yeah, so the accelerated was shrunken down into like 8 to 10 week, I guess, classes. So that was an experience.
Did you like that more, or didn't you not like that more? Would you have rather it be 2 years, or did you think the accelerated program was okay for you for like your feel or anything like that?
Well, for me, I know I wanted to work right away, so that was very beneficial for me. And I know I just wanted to like just get into the field, but I know at the same time, like very stressful. We used to like we used to carpool and then like cry together.
Yeah, and then at least for me, I think it's the same boat. I guess for me at least, I like the consistent change of classes just because I always felt like I was always trying to learn in a fast pace. And that really reflects on like real life after school where like you're in a position and you always have to get like tasks done. So I think that really prepped me for the workforce that we are in right now. And so yeah, I think I like the format. Yeah.
Okay, fair enough. I mean, that's cool that you all both had your reasons to go through it, and it seemed like it worked out well. I definitely do agree with like they having to learn new things because I feel like you're always learning new things on the job. So you all do have different concentrations. So can you tell me what your concentrations were and why? Jamie, you can go first.
I went the health promotion and education route. And the reason why is that, like I said earlier, is that I wanted to be a gateway and understand the barriers and facilitators of how to go about community and clinical research. And so ultimately, just trying to learn how people react to things and how I could be a driving force to either benefit someone's life or understand why they don't like to do certain topics or certain behaviors. And so I think people are fascinating. Um, and I think learning about what they want really helps me understand what is a priority to certain communities or cultures or especially during these like trying times where everything is so blown up on social media. um, it's I think this is where public health could really jump in and understand like and hear people to see how we can cater and tailor to people's needs. So I guess that's how I went to health promotion and education route.
Awesome. And you, Lulin?
I chose global health, so I was like the first cohort for the global health concentration at CFC San Marcos's Master Public Health. And I like when she says she's an introvert, I'm very extroverted, so I just like meeting new people and I just like feed off of energy. So I chose global health because I always was interested in working with people from different countries. And like how I mentioned earlier with the Naval Health Research Center, how they was very global as well. I was that piqued my interest, and at that time at San Diego State University, I was also in a club called the Public Health Initiative, and that's where we work closely with Mexico. So, and we're in San Diego, we're really close to Mexico. So, I was just trying to like, that's how I learned how to like border health and just having good like global health diplomacy between the U.S. and the Mexico border. So that was like another reason why I really was into global health. So I just wanted to very like increase my skills and how to like navigate through working with different countries, just so the health here in the U.S. is safe as well as other countries. Again, like I mentioned, how diseases know no borders, and we always have a lot of immigrants coming here and people traveling. So I thought it was very important to like for me to like gain more global health skills.
Okay, well, that makes a lot of sense, and I'm glad that you both have different concentrations and have like different reasonings behind why you chose them. I think that's pretty awesome, and it's definitely going to help someone who is thinking either global health or health promotion, and they will be able to hear maybe your reasoning. Maybe they'll be able to reach out to you all and ask you all some questions, and you can guide them down that path. So back to Jamie, you were you were Pacific Islander Community Health. You did a Pacific Islander Community Health internship. Didn't you talk about that experience?
Yeah, so like earlier, that's where we met. So I guess um,
So you did this. Oh, so you were in the master's program when she was in undergrad. Is that
oh no.
is
So
yeah? Tell me.
in my undergrad, I graduated like 2, 3 years,
I think just
a year before her,
Mm-hmm.
and then I took my gap year as like a research assistant intern,
Gotcha,
and then
gotcha.
she jumped on, and then that's how we met. But we did continue Pick Health work throughout our master's program.
together.
Okay, awesome. So was the work that you did there any different from earlier on, or was it the same sort of projects?
It was pretty much the same projects, just focusing on Pacific Islander community health, fitness, and wellness with nutrition. So I guess what we really gathered from that is understanding the global and health promotion aspects and how they interconnect. And so I think that's what really drove us and kept us like pumped up during our master's program too. So it's really helpful to have a internship or experience while in school to like help apply what you learn into what you're experiencing. And so, yeah, that was my experience in Pick Health. Yeah.
Yeah, that's awesome, and I definitely agree with that. Like, if it wasn't for my internships, I wouldn't have been able to apply like the community health needs assessment stuff that I was
Mm-hmm.
learning in classes, and that was like super helpful in everything that I'm doing up to this day. So, I'm grateful for that. You are also the secretary of the graduate organization, Public Health Graduate Organization. Talk about that. How do you have to run and get that position?
Yeah, so sort of like Pig Health, we spoke with Dr. Holub, and she was also the lead of that organization. And essentially, because it was like their second year of having that organization, you're like, why not? I mean, because we are from Chula Vista, and Chula Vista to San Marcos is like a pretty hefty drive. It's like an hour drive. So we're like, might as well like do it all there now and experience it since we're like driving all this way. But yeah, so we decided to do it, and then I went for the secretary role just because I like organizing and taking notes. Um, but other than that, really, I guess helping build that organization um, was very interesting to experience as well.
Okay. And then Llewellyn, you were the treasurer for the graduate organization in Public Health Graduate Organization. I don't know which way I was supposed to say it. Sorry.
Like basically go PH, so graduate organization, public health. So
Okay,
yeah.
it just messes with my mind.
Yeah, it's
Just
okay.
saying
Just
it that
the
way.
acronyms.
Yeah.
Yeah.
But okay, tell me about why did you want to be the treasurer of this organization? And what did you learn from it?
Oh yeah. Also like her like just wanted to make the most of like the graduate program and just build like a strong like public health network at San Marcos. And I chose treasurer because like maybe I at the time I wanted to like learn more like how to like manage money for like, organizations and ways to like gain funding and just get more involved in how um, to make the students more involved in the community as well as having like good social gatherings to build like rapport within our cohort as well. So that was like the main reason that I joined GoPH, just to build more network and probably like really stress from that master program and like to make like friends like that or like outside of class. So that was like the main reason I joined.
Okay, that's dope. And tell me a little bit more about GoPH. What do you all do at GoPH?
Basically, it was like a lot of like trying to connect with local aid public health agency. So luckily, our school was connected with the County of San Diego, our local health public health department, as well as like other places, like connecting with other schools and nonprofits here in San Diego. And it was just mostly trying to build connections and just make ourselves known um, in the public health field in San Diego because at that time before San Marcos, the only public health school was San Diego State and UC San Diego. So San Marcos was pretty new to the game of being noticed in the public health field here.
Okay, and that's awesome. That you were able to build up on this organization, and it really seems like it was a community for public health people to just connect and meet each other, and that's probably a dope thing to do, especially during school. I feel like people undervalue how much you learn from other public health people, just in general, from being around and just talking to them about random stuff. So yeah. So back to JV. You were STI and HIV prevention on the CSUSM project.
Yes. So in the master's program, we did have to do a project. So it was either a thesis, which Louielyn did, and then I went the capstone route. And I know I said that I was an introvert, but like just talking out loud that most of my experiences with people. But I mean, everyone has their own definitions of what an introvert is. But anyways, so for the HIV STI project, the goal was to understand and basically do a needs assessment of like the knowledge of STI prevention and HIV education. And so that was another experience that has really um, pushed me into going into research, just because that did also involve like clinical and community aspects. And so I think that experience has really shown me that there is a lot of things that need to be learned and promoted and shared to the population, especially students. Um, but I feel like I would just assume that just because I was working on that area. So I think that was a great experience as a capstone project, and it has really taught me to manage my skills and whatnot in that public health master's program, or CSUSM's public health master's program. So yeah.
Yeah, that's dope. And seems like a great experience. And then you were also a part-time research study coordinator, community health specialist at UC San Diego School of Medicine.
Yes. So at the same time, while doing all that, I was also a like research assistant part-time coordinator with a cancer group, specifically towards reproductive health. And so I guess that experience also amplified my want to learn about clinical and community research and how they like uh, bridge together. Um, yeah, that was a great experience as well. I've learned a lot about how clinical work is different from community work.
Okay. And do you want to talk a little bit about some of the differences you learned, or just one difference or something?
Yeah, I think essentially the major difference is the goal, I guess. Um, Obviously, everyone has different goals, but the main difference is that obviously clinical is more in the hospital versus community is more outside of the hospital. So obviously, sometimes people will be like, "Oh, I've done this," but that's what they want the like hospital to know. But sometimes like they do other things outside of the hospital. So I think um, that's what like the major thing that I've learned, and the major difference is just the culture, I guess. Everyone in the community research is more trying to understand how to work with the community, and clinical is more trying to understand based on a certain um, illness or preventing something from happening. So I think experiencing both at the same time was definitely overwhelming, but it was like the good overwhelm feeling. So yeah.
Oh, that's good. And then go back to Louielyn. You were a PIC health graduate research assistant. So talk about that. Was that like just continuing on, same work, different work?
I was continuing on like following Dr. Holub, and this time was helping her with getting more grants. So I was able to experience like grant writing and like how to prep it and then implement once we got the funding. So at that time we were helping her with the more a family based approach, because before it was just like individual. So this time it included children in the study, and um, we it was like led by Native Hawaiian Pacific Islander fitness instructor. So it was instructors. So it was very like tailored to the community, and we also had like the co-PI was Native Hawaiian Pacific Islander descent. So it just made sure like we were culturally sensitive, and just make sure it's really for the community, and like conducted needs assessment based on what they wanted and how they wanted it to be implemented. So it was like a good experience, and I still use the same skills that I learned from that experience to today. I think it's very useful, and I really praise community-based participatory research, and I think that should be definitely applied like probably across public health overall.
Yeah, I completely agree with that. I second that 100%. What was Dr. Holloway's position when you all were going from undergrad to graduate school, if you remember?
Yeah, at least for me, my last year at SDSU, she was one of my teachers or professors. And then she announced that she was moving on to San Marcos, and I was like, oh, that's cool. And then so I reached out to her after I graduated my undergrad. Mm.
Oh yeah, and then she was like assistant professor at San Diego State, and then she moved to the assistant professor at San Marcos. And I remember her the reasoning why she moved to San Marcos because she liked it how they had more community based funding, so that's why she went there to like it was more tailored to her research interests and how she wanted to um, collaborate with the Pacific Islander community here in San Diego.
That's some key insights right there. Like looking at universities that have more funding focused on community-based work. Like I don't think people even think about that, but I'm really glad that you mentioned that because I think that that is something a lot of people don't even take into consideration. I myself to take that into consideration, but I think it is a beautiful thing to look at because you have the ability to reach out to people and ask questions and find out about that. And I think in public health, especially if you want to like be in the field or like I feel like just getting that experience of meeting the community and being in the community is just so vital to that entire leading culminating public health experience. Um, Louielyn, you were also a medical support assistant at San Diego VA healthcare system. Do you talk about that one?
So at that time, I also needed like a full time job, like to help like with my financial, like to pay for the grad program, and I just thought if I worked as a medical assistant, it would just and even though it's like more of the administrative side, like just checking in patients, I just wanted to be in the system, just so because it's like just hard overall just to get in the federal system to in applications for jobs. So I was hoping that was going to be a stepping stone for me if I was already in the VA system. That if I wanted to move on to the because the VA also had like a research department, so I was trying to move there eventually. So I didn't, but it made me like move on to UC San Diego. But it did help me understand more like the healthcare administration side as well as like the public health side in like hospital, and also made me realize I didn't really like the hospital setting.
Yeah, that's very similar to me. I didn't like the hospital setting at all. Um, so how did you all balance all of these different things that you were doing during your master's of public health programs? Because you said that it's an accelerated program. You're going through classes like chop 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 chop, and then you all have all these different positions and whatnot. So how are you balancing all of
How did you balance it?
How did I balance it? So first, coffee.
that?
Coffee was very beneficial. That caffeine, it has to hit. Um, and then essentially, I did have planners. Like I did have like a written planner and my Google Calendar, and just always writing stuff down because I feel like I don't like having so much information in my brain, and so I think that's how I managed it, and especially just committing to what time you like schedule for a certain task or like event and committing to it versus like multitasking. So I think that's how I managed.
I think so too. The same thing with planners and then just having like a good support system. So again, I had her as like my support system that we understood what we were both going through, like trying to balance like work, school, and like internship. And then we both lived all the way in Chula Vista. So that luckily we had each other to like carpool and just having like my family was very supportive of me during my grad program. So they made sure like I always had food ready to go and like they were very patient. Like if I didn't attend a family function, they would be very understanding and very like supportive during like providing me shelter, so I didn't have to work too hard of trying to find like to support me for housing. So luckily I had a lot of like friends and family supporting me throughout that program. So if I didn't have them, I think I would probably not survive.
Yeah. And another thing I do want to add on is obviously what Louielyn said, having a support system and also like scheduling self-care in your schedule. I know that like I'd be like, oh, did you buy a mask to like self-care or pamper yourself? So I think for like any future leader should schedule some self-care in their time management system. So
Absolutely. I think that if one thing I feel like COVID-19 has taught people is that you need to schedule some time for self-care because it is so essential to just like general overall well-being. So
Mm-hmm.
absolutely. So thank you for that. And you graduated and you became a senior research assistant for the research study coordinator at UC San Diego School of Medicine. And this is Jamie I'm speaking to. So what was that thought process graduating and then like getting this job, looking for this job and all of that?
Yeah, so when I was graduating, the full-time coordinator at the time was moving on to a different position. And as they were interviewing, um, I was just pulled into the PI's office and was like, oh, how do you feel about this? And basically had like an interview on the spot. And then I was later on promoted and then became a full-time coordinator. And then so I guess some experiences that has changed through my like part-time to full-time position is that for those who are coordinators out in the world and listening, make sure you track everything and take notes just so that whoever takes over will know what you've done and it will help the study overall. And then so yeah, that's how that happened.
Okay, that's awesome. And what sorts of things did you do?
Yeah, so essentially, I helped the PI manage like the multiple studies she had, and then so I would help contact cancer survivors and ask how they're doing and how they feel in the study. Sometimes do qualitative interviews, understanding what are their needs, taking it into account, and then some quantitative work, and so helping provide like reports for papers and um, I also did some audit reviews and IRB submissions. So yeah, a lot of
Fun
those
stuff.
paper stuff. Yeah, yeah. So
Your face
I don't
when we
know.
said IRB.
I know. It's fun. I was like, he
That's,
knows.
yeah, that was the most miserable part of my entire Masters of Public Health program, having to do that IRB.
Oh, IRB. Yeah.
Okay. And then afterwards you became a case investigator at the County of San Diego. So we talk about this position.
Yeah, so because of the pandemic and due to some funding, um, I left that position at Morris Cancer Center, UCSD, and then I did apply because it was like pre-pandemic or the pandemic was starting to happen. So I did or um, apply to be a contact tracer, but I also saw the case investigator. Um, but for the case investigator, I unfortunately did not do a lot of time at the county. However, I did have enough time to understand the system um, and try to adapt what I know to the next position I was in, which is the contact tracing lead position at UCSD. And so I guess what I could speak of the case investigation is that it's a very hardworking group and that a lot of stuff is going on in a short amount of time to plan for something that was not expected. And so that's what I've learned.
Yeah, and that I know that was probably a lot. Well, when did you start the contact tracer job?
I started the contact tracing lead position probably like 3 weeks after the investigator position, just because I applied for the position, like both positions at the same time. But I went with UCSD just because I feel like they met my goals more. But it was the first time where I was able to experience a system not being built and being part of the building of a certain like flow. And so I feel like that position was really life changing, especially because also the people, the culture in that group was also really great. And so it's just unfortunate with that position. I've learned that obviously everyone has different opinions and views and beliefs, and the way people react to people, especially just doing their job. I think the main message I want to like share, if that's okay, is that just be nice to people. Like even though like you don't have the same views, it's always good to accept or just listen first and just acknowledge that there are people with different views out there and be respectful. So I just want to share that message, especially as the pandemic is decreasing and hopefully it stays at a low point. But I just want to share that please be nice to people.
Yeah, absolutely. We need a lot more empathy in this world. I feel like people lack a lot of the empathy, and just having. I feel like we've become very polarized as a society, and we don't want to have conversations around anything anymore. People just want to like shut other people down, and I don't think that's very progressive in any sort of way. Um, so what was it like building this entire contact tracing lead, whatever you want to call it, system of like doing all of that? Because I know that's a lot from like the personnel to everything that's going on in the background. So tell me about a little bit about that.
Yeah, I think I guess the best example is like it's like getting a cookbook and then there's no instructions on how to make a meal. And so it's essentially like experimenting and trying to understand um, what resources we have and how can we use it to its best ability, and like how can we ensure that people feel comfortable with the system that we're building, just because it is important to have like a good system in order to keep people liking and working and being able to feel safe in an environment that tailors to your like coworkers and to what you're trying to complete in that group. I hope that makes sense. But yeah, so I think my experience there, I was glad to write a couple recipes. Um, but other than that, I feel like, yeah, that position has really helped me grow into understanding what is needed to go into a system, and just understanding like if that system fits within a bigger system, how does that other system influence the rest of the bigger picture? And so, yeah, that's how that went.
Yeah, that's a lot of systems talk. Like I took a class in my MPH, like systems thinking for public health, and like I never thought it was anything of value. But then, but then, like when you really think about it, things do influence other things in such interesting ways, and they're just weird things that happen when you take these big systems and you combine them, and then some weird thing happens, and you got to deal with that, and then that leads to something else. But I'm going down a path that okay. So next,
Yeah.
so were you promoted or shifted into your current position as a dissemination and implementation science coordinator?
Yeah, so I transitioned out of the COVID team and moved to the dissemination and implementation, or also known as DNI, coordinator position. Just because obviously the pandemic hopefully won't be there for a while, and I really wanted to experience more management and obviously improve my system building skills and leadership skills. And so I applied to the DNI Science Center at UCSD. And right now I'm currently trying to grasp as much information about DNI, just because that realm of work is so broad to the point that you could learn so much information, but also narrow down how much you want to learn. So right now I'm in the prepping learning stages of DNI. So hopefully in the future, I become a DNI expert, just like my fellow coworkers. So yeah.
You'll definitely get there. No,
Yeah,
no doubts
hopefully.
about that. Did you have to do any management in your contact tracing lead job, or no, not at all?
Yes. So as a contact tracer lead, I did not conduct the calls to those who were exposed. I was more of like creating schedules and making sure that my contact tracers felt safe and were mentally prepared for their hard day. So I feel like that's where my management skills really improved, and also built really great friendships through that. So yeah.
Okay, awesome. And then moving on to Louielyn. So what was your process from going from your MPH into your research data assistant at Mother to Baby?
So I after like the VA, because it was like right after when I transitioned to the mother to baby pregnancy studies. So it's like a observational study where we wanted to look where we interviewed moms as well as look at their medical records to see like medications and vaccine safety in pregnancy. And a lot of these moms had autoimmune diseases like rheumatoid arthritis. So at that time, I didn't want to stay at the VA anymore because I was in the emergency department and it did require a lot of my energy always to be on top. And then at the same time, like the hours weren't working for me, as well as like I was trying to finish up my thesis as well as like the program overall. So I also wanted to move away from the federal agency and see what it would be like in an academic institution. And at that time, I was like pretty interested, and I'm still somewhat interested in just trying to figure out what um, PhD in public health program I wanted to do. So UC San Diego has like a joint doctoral program with San Diego State, and I thought since that's like one of my potential schools I wanted to go to, like if I got into the research realm there, it would be easier for me to get into the doctoral program there. Well, that's why I moved over there and just wanted to get more of a research experience in an academic institution. And UC San Diego is pretty big in research overall. So I know that there will always be funding there. So that's why I applied over there as well.
Yeah, that makes a lot of sense, and I'm glad that like you're thinking forward to what you might want to do in, or like what you want to do in the future, and you're planting those seeds to really help you get there when you do need to get there. So what do you do, or what did you do in this position? Sorry.
So over there is like more of data collection. So over
Mhm.
there, I was collecting and tracking medical records, and I was doing like the first look at the medical records of abstracting data, looking at if there was any um, thing that's like out of the ordinary from the pregnancy. So we would follow the mom from pregnancy to all the way to the child up to 5 years old, and to see if there's from that medicine that the mom was taking during her pregnancy, was there any um, dysmorphology or anything like out of the ordinary of the child, if they were um, just to make sure that medicine was safe for the for moms or just like in pregnancy. So it was like um, funded by like major pharmaceutical companies like Solara, even Pfizer. We had some of them, and yeah, so it was like very interesting to see like how different types of funding, who is funding you, where like a lot of the money comes from, like pharmaceuticals. So it was very interesting to see like how we needed to see like the clinical trial 3 of like how this, although this um, medicine and or vaccine was approved by the FDA, but it was never tested on pregnant women. So it was like good to see like how it would affect after it was approved.
Okay, yeah, that is awesome and very interesting stuff. Um, and then you are currently in the position as a program evaluation specialist at UC San Diego Health. So what was that transition like for you?
So after that, like I left the data assistant and I wanted to go in a more like public health realm.
Mhm.
I was moving away from just looking at medical records. Like I wanted to work more in the community. So as a program evaluation specialist, I evaluate the mental and behavioral health programs here in San Diego County that are more focused on prevention and early intervention, as well as I am also evaluating a tobacco control initiative that's funded by the California Department of Public Health, and it's working with the American Indian population here and the tribes all over California. And what helped me a lot was the PIC Health, like learning about community-based participatory research and just how to work with tribes here in California, and just understanding how a lot of the times when I was like meeting and greeting with the tribes, they didn't have that much experience working with researchers, and they talked about how there's a lot of historical trauma with research here.
So you were saying dealing with historical trauma.
Oh yeah, just learning about the historical trauma and just how important it is to like be very have cultural humility working with communities, especially tribes that have a lot of like history and past that like the state and federal government like took a lot from them, and now we're trying to like come back and tell them what they need to fix. But I liked how the current at my position now that we're working collaboratively with the tribes and just learning more about tribal sovereignty and how they want to work with tobacco control, trying to move away from commercial tobacco and more focus on learning the traditional teachings of traditional tobacco. And little did I know that the reason why tribes use commercial tobacco because it's just a historical fact that they commercial tobacco industries as well as the federal government made the tribes stop growing traditional tobacco, and they like basically burnt all their fields, and it took away a lot of them how they were using traditional tobacco safely to smoke it and give it back to their gods and respect in ceremonies for the people and their ancestors. So that's the only way they could go back to their traditional teaching of using just commercial tobacco. But little do they know that there's like nicotine, and then that their air is not clean from the commercial tobacco, not like their traditional tobacco. So it's just learning from the community how they're trying to come back and just control like their health without having federal or like state or other public health researchers telling you how you need to lower your smoking rates, but they're doing it on their own and just claiming back their sovereignty and their traditional and culture. So that's what I'm very enjoying right now, like learning from the community and just we're learning from each other.
Yeah, that is awesome, and I've definitely had I have an experience with like Alaska Natives, so that tribe, and I definitely understand that you can't come in there trying to be all white professionalism walking in there because that's just not how they rule. And I think really understanding the cultural competency and just the trauma that they have and continue to deal with, and really approaching from a place of empathy and knowing that they have the power to do the things that they need to empower their health, and we just need to give them the resources and the help to help them help themselves more. So you talk about some evaluation that you did. Did you do like a evaluation class in your MPH program?
I know we touched on it like small, like we learned like program development, program implementation, and program eval. So it was like touched upon throughout. So like I'm applying a lot of what we learned in undergrad and grad to my current position.
Okay, so it sounds like you had to learn a decent bit about that, like in the job in itself. What was that process like for you?
Well, it was like at first it was kind of like, oh my God, where's my textbook? How do I do this? But then just building like an advisory committee and working with knowing how to work and talk with stakeholders and just knowing the right instrument to measure what kind of outcomes that you want to see from your program was very beneficial. So a lot of times I do like for qualitative, I do a lot of key informant interviews, and we'll start doing focus groups for both the county program as well as what I'm doing with the American Indian tribes here in California, and just collecting data through surveys and just knowing what type of question you need to use and what, like again, like which instrument do you need to test, and will grasp the outcomes and like tell the story of what's going on with the program and ways to improve, and where should more funding go into.
Yeah, that's awesome, and I'm glad that you're learning that. And I feel like that's like a crucial skill for like public health people to know, like program evaluation. And it seems like you got a little grasp of it in your MPH and undergrad, but now you're like understanding it a lot more in the real world context. So that's dope to hear. Um, Moving on, so we have you both started the public health palettes, which is on Instagram at the public health palettes. So tell me about the process of that. Did you all start that when you were in your MPH program?
So we started it in what 2000.
May 2019. So
Okay.
when we're about to walk for graduation,
Yeah.
basically.
Sure.
Yeah. So do you wanna?
So we did it because we graduated December 2018, and then we had like more time since we finished, and then we were gonna walk around May 2014, 2019, and they were like, "You want to make an Instagram?"
Yeah. Yeah, we were just like, working out one day and we're like, there's just so much public health information out there. Do you want to make a public health Instagram? And so I think it was more like because we bonded so much during the master's program and learned so much too. And we're like, why don't we just make one for fun and just like share what we like to do and what we want people to know, or just be aware of. And so I think we really wanted to create the public health palette to share information, gain information from people, and to build connections. So that's how we met you.
That is correct. That is correct. I'm definitely very grateful and glad for like all my online Instagram friends that I've created and made and lead from it. As you've said, I feel like there's it's been amazing to see like the growth of like the Instagram public health field and just everyone that's popping up on there. And I hope that more people pop up on there. So you all had no like idea that you all were gonna start this. It was just kind of like on the whim. Oh, let's just do this public health thing.
I think essentially we just wanted, because we have experience with like San Marcos, UCSD, and SDSU, we also wanted to like bridge those universities together and help build like those public health like universities and like have a link to it. So like from our past experiences at San Diego State and like Cal State San Marcos, and with our experience with UCSD and like the county, we just wanted to show that public health is a thing in San Diego, and that we want to connect and let people know that these are the resources you have, and this is the public health atmosphere, I guess. So
Okay.
yeah.
Tangential question. Did you all go to the APHA that was in San Diego?
Yes, I actually
did.
presented.
You
at
did?
the appreciation.
Right. That's awesome. I'm upset that I didn't have an Instagram account for that, so I'd
You
know you
were-
all then. Right.
No, that would be so cool.
Yeah, San Diego is awesome. I enjoy that a lot. But yeah, okay. Back to the interview. So tell me who decided on the name, or did you all like have to vote on it, or like how do you come up with the name?
How did we? I know we were.
I think we were talking about makeup.
Oh yeah.
We were talking about makeup, and we're like, there's so much makeup out there. If only like public health, like health policy would be mascara. Like, yeah. So I guess the makeup world.
Makeup world, like
yeah.
artists, like how there's like a palette for like almost everything. So we, were
Yeah.
like, we could be the palette for public health
Yeah.
and show different types of public health like topics.
Mhm.
So that's how it came about too, especially since
Yeah.
I think at that time like public health like professionals weren't really on Instagram. I mostly saw just like people making nursing and doctors how to be a PA, and that I was like, what about how to be a public health professional?
Yeah. Yeah, so I guess we both brainstormed the name. It was just trying to, I guess, incorporate what we know and what we like with public health. So yeah, we like makeup, I guess.
Makeup allows you to be creative, and then
Yeah.
like anybody could use makeup. So
Yeah.
like anybody could learn about public health.
Yeah, so let's make a palette. Merch coming. No, I'm just kidding. No merch. I mean, I know, yeah. Like blue will be like health policy. Yeah, so.
Okay, and I actually love that a lot because I do agree. Like makeup, well, I don't use makeup, but I know there's a lot of different kinds of makeup out there, and there's a lot of like variation in public health and what public health is and what it means to people. And yeah, I feel like we were some of the first people on Instagram as public health professionals. Just I hope that we continue to just be there and showing up because it's a field that's been underrated and undervalued for too long, and we just need to show people that there is a lot of great things that you can do in our public health. So I appreciate you all starting this, and I appreciate the name a lot too.
Yeah.
Yeah. So how has this evolved like from starting it to now? Like, has anything like changed? Do you guys plan out things? Did you have like a strategy at first? So like, how do you approach this?
At least for me, and correct me if I'm wrong.
Mhm.
Just go with the flow. I guess we do meet through our busy schedules. Like, oh, you want to have like a the public health palette meetup and just like plan and like talk. And then so I think it's another way for us to like reconnect and like reground ourselves, and then just like talk about what we want to post that month, or
Mhm.
who we want to reach out to. Um, like what is the message we want to send, and how can we be like culturally aware and sensitive to like the stuff we post. um,
Yeah, and then honestly, I didn't know that we would even reach people because
yeah.
at first all our followers were just our friends.
Yeah, yeah,
Yeah,
but
now like people asking about like um our jobs or just about our MPH program, and then meeting other public health people like you. It's like very like interesting to see how like little like I think we just barely hit our 2 years that evolved this quickly like that, and it just allows both of us to be very creative on how to like message and share interests, and then what works for like who's gonna look at our posts, like
mm-hmm.
how do we reach them in a way that they understand and then they'll
Yeah,
remember it.
yeah, and especially since a lot of Instagram users are probably more of like the millennial Gen Z um like age. I'm
Mhm.
assuming, don't quote me on that. But at least like I feel like that's a good population that we also want to reach out, because I feel like the more community we build, the more change we can make, even if it's just like a simple post. So yeah, that's wow. Sorry, I just reflected. Yeah, I just reflected like, oh wow. So
Yeah, that's awesome. That's awesome, and I'm glad that you all did it. And I do think there's like so much value, and like as you said, people are reaching out and asking questions about your job and your MPH, and like public health is just so new to a lot of people. And I think it is so important that we have public health professionals in these spaces and really just sharing what they do and how they do it, and in all the different ways and facets. And I love the public health palette. I love the name a lot more now because I understand. You all should make a video explaining the name so
like it's
you
not
can
like
get
a makeup palette.
it.
Oh yeah.
I love the game a lot more.
Yeah.
So what is something that you'll have learned doing this that you didn't expect?
I think for me, what I learned is like there is a lot of public health people out there. You just need to like find them, and I didn't expect that this will like bring us really close to other public health people and like just bridge the network because I was just mostly connected with San Diego public health people, but now with this Instagram is reaching like even people from Canada and or like or just around the
Like
US.
India, there was one.
Yeah, there was
India,
like one in
yeah.
India that reached out, and I was like, wow, this like Instagram's cool. Well, like, you're making international friends
I
here.
know. How about let me think. I guess um for me at least, what I learned is that it could be hard, or there's a lot of time into going into a post. Like I didn't realize that planning and like when to post, or is this post even like relatable to people,
Mhm.
how much time it could take. So like I said earlier, schedule your time meaningfully, and you'll get great output. So that's what I learned.
Mhm.
Yeah, that's awesome. Like, were you gonna say something, Lulin?
No, I just agreed. I was like, yeah, like trying to figure out what even hashtags to use so it
I know,
shows in
yeah.
your profile.
Like hashtag what? Yeah.
I,
That's
I,
true.
I had like a book of pages. Like I literally went on Instagram and I looked up hashtags similar to public health, and like checked how many like how many people see it, how many people search for it, or something like
Like
that.
the analytics of a
Yeah,
hashtag.
yeah, I went way too hard into it at the beginning, to be honest. But I
But
digress.
that's good. That could be a tool
It,
to
it
share.
could it could be, but I definitely agree with you all with like the community of building online and just having these different people that you might have never met before. And like I really appreciate all the public health community and the people that I've met and learned from just online and over this last year, because everything's pretty much been online. And I look forward to like being able to meet up with a lot of people that I did meet online at some point in time.
Yeah,
So,
come to San Diego.
I
yeah,
know, yeah.
well, Sandy.
Tacos. Talk about it with tacos. Yeah. Oh my god. Sorry, I had to pun it.
No, no, you were fine. So, San Diego is like literally my one of my favorite cities in the U.S. that I've been to. So I would definitely be back there sometime soon. So we will link up. No worries about that. So where do you all want to take the public health pilots in the future?
Makeup? Just kidding. Makeup? That's a really great question.
I know we're like just trying to go with the flow and just like like better at like health communication skills through social media. Because now I know like a lot of like you even see the California Department of Public Health on Instagram, even the president, everybody like CDC. So I'm like, I kind of want to be like that, be able to reach people and like teach people and like knowing the way to like reach people in a way that tailored to them and that's easily digestible, like all that health information.
Mhm. I agree too. And also like providing people with resources and like telling them that there are public health opportunities out there. You just need to create one if there's not one. So yeah, that is, I think that's where we're going. But we'll plan it. We'll plan it. Yeah. But I mean, there's no barriers. You never know. Makeup line could come up. I'm actually like thinking about it now.
I hope there's a meal collection.
No. Like each like makeup line will be like the environmental pack. Or, like, yeah. So you never know.
Yeah, I think it's good to think big and like throw out these funny ideas because some of them might just come through. You never know. You never know. But I think it's so important, like this health communication skill that we are gaining. It's not something that people teach or like they're not very effective at it. So I think just being able to continue. You've been doing this for 2 years. You all said that's a lot of learning and a lot of like you all can literally teach someone about health communication on Instagram. And I think there's going to be a lot of value in that going into the future because that is where people and communities are, and we really need to be able to make information to reach them where they are, if they are on Instagram or TikTok or whatever the kids these days use. So where do you all want to see yourselves in the future?
That's another great question. Do you want to go first?
I know I want to do a PhD program in public health, either in global health or epidemiology, but still trying to find like the school I want because it's very difficult trying to find like who's going to be my mentor there because I got lucky with good mentors my undergrad and grad, but they're not going to follow me there. So that's where I'm like trying my best to try to make connections. Um, that's why I'm like at UCSD trying to find the professor who's in that PhD program that I vibe with, that who I want to like have the same interest in who I want to be like as a professor. So hopefully become a professor in who knows how many years, but I'm still down.
I guess for me, um, like I'm going with the flow. I think there's just so much happening right now that I'm like learning, and my plate is pretty full. But if I had room in my plate, I think essentially getting certifications, more primarily towards like health promotion and education, and just really understanding like different topics. So I know right now like health promotion and education, but understanding like environmental health or health policy, just to help like bridge or connect all public health realms in order to create like the ultimate knowledge capsule. So that's my goal. Um, or get hired by her if or when she becomes a professor with a study, like hire me. So
yeah, with her organization skills, yes.
so that's
Awesome.
all.
Yeah, it's awesome. I look forward to seeing you all on this journey and just seeing where everything takes you all and where the public health pilot goes and where both of you all just go in your journeys on. I look forward to that and just being in the community and with you all as public health professionals. So moving on to the last section of the show, the Furious Five. But before I move on to that, is there anything else that you all wanted to mention or say or something that I didn't ask that you wished I asked?
No, I don't. I think I'm good. Besides, like, thank you for inviting us.
Yeah.
Yeah, my pleasure. Like I'm really glad to finally connect with you all visually, and hopefully we get to do this physically in person at some point in time. And I'm really glad to have met you all online and been able to connect because I don't think I've said this a lot of time in my podcast. But the public health community has really been very helpful to me in the last like year and a half or so. So I appreciate all of you all, and I'm glad to meet up in this realm and tell your stories. So moving on to the last section of the show, the Furious Five, five questions that I ask all guests. I'm going to ask two guests, so I guess it's Furious Five squared today. So number one, what advice would you give to a student trying to pursue a career in public health?
Advice. Let's see. I think for me is always try. Go for it. This is cliche, but just do it. Um, I think with students, they are just focused with one topic, or at least that's how I've been raised in the public health realm, is that only focus on like STIs or child development. But there's just so much in public health that you could learn. Just do a topic and then it will bring you to your next journey regardless. Um, so that's my ultimate um, tip or suggestion, is just to go with the flow, do it, and don't hold back. Enjoy the process.
Yeah. So like basically like hers like how you could see just like from our experiences, like just we basically took the time to learn about all the possibilities in public health and just take each experience like good or bad and like see it as like a gateway to find like your place in the public health field. And lastly, like just how we kept talking about the public health community, like the importance of networking and like getting close to your professors and just people in the public health field, but doing it like in a natural way that like be like a friend and be like kind, like what she said, not like say, I heard you're in the public health program. How'd you get in?
Yeah.
I followed what was required on the online.
Yeah, so that, amen to that.
I was like, not even a hi.
I know, like, hi, how you doing? But yeah, so just be kind to people.
Yeah, because like when we're not a public health professional, we're just like a regular human being. So just being remember, like how she said, be nice to people, and like if you want something from them, don't make it like so forceful. Like earn your way of getting it. Like how um we will earn our like data, like working for communities. Like it's like a give and take. So that's what I like the big advice I would give to people entering the public health field.
Yeah, absolutely. I like that a lot. It's like building relationships, like real relationships, and not like forcing anything onto people. So definitely. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I think for me, just be prepared to work with different personalities and like people from different backgrounds, and that having like practicing like your emotional intelligence, like understanding like people's like how they feel and like listening, active listening, and paying attention to people's body language, and just being flexible with how you work will really take you far in your career and as well as like any career. I feel like just being emotionally intelligent and just flexible because you will be working with different people at different points of their life, and you never know what they're going through too.
And then sort of piggybacking off what Louielyn said, I think for me it's just if they want to be in a like high stress position or chill position, I think just understanding their own barriers or like limits. I know with some work cultures is that working nonstop is like the model, but it's always good to know your limits and not um, basically push yourself to something that you're not given to give your all in order for you to get a position that you want or you can't even have. So I think just understanding your own barriers, not pushing yourself and let it come naturally, and just learn as much information as you want. Not as you can, but as you want to. So
I like that a lot. And healthy boundaries never hurt anyone. Number 3, what's something you're working on improving in your life right now?
um, this is really random, but because we're in the pandemic, it's little, but it's self-care. Basically trying to walk more. I'm always in my computer, so walking more, improving my mental health, um, making sure that I have goals that are reachable, or having sub goals to reach that goal, and just like telling myself that it's okay to fail because you could always try again. Um, that's what I'm working on.
Same like her, like basically like taking care of myself. Like I definitely need to practice what I preach on our public health platform. Like if I'm telling people to be healthy and to go walk 10,000 steps every day, I need to be doing that too. So that's what I'm trying to improve. And like my main thing is like if I'm healthy, that I could like help people be healthy. And like I think as public professionals that sometimes we forget to take care of ourselves and we're too focused on taking care of others and making sure like the population overall is healthy. So I feel like a healthy you, it will be a healthy we and a healthy us. So I think we really need to also don't forget to take care of ourselves before helping others to be healthy.
Yeah, of course. You can't pour from an empty glass or empty mug, I should say. Number 4, professionally, do you recommend anything?
I think for me, just what she said earlier, be prepared to um, talk with people and connect with people that don't fit your personality. I think that is one of the major skills to gain in public health, especially since everyone comes from different backgrounds. Also, understanding that those you have or those you work with are human and have their own limits too, and it's good to respect that.
I think for me, like what helped me even like make a lot of our posts on the public health palette is like subscribing to like public health journals and to that interest you. Like I'm subscribed to like PubMed to see like what is the newest research so you can keep up to date, as well as subscribe to like bigger public health agencies like the CDC, the APHA, so anywhere or even like places where you want to work at, like subscribe to them, like so you could keep you updated with the news, what's going on, as well as like any opportunities for like jobs or like even fellowships. So subscribe to that email list and actually look at it at your spam mail or something. Like
Yeah,
the
that's some great advice. And last but not least, where can people connect with you all too?
our Instagram,
Yes.
follow us at the Public Health Palette, and like you can also add me on LinkedIn as well.
Yeah. So Instagram and LinkedIn are like the best ways to connect with us. But I mean, if you find us online and make sure that it is us online, any connection is fine.
Okay, that's awesome. And I will definitely link to your LinkedIn and the public health palette in the show notes. But thank you all so much for joining me today. I appreciate you all sharing your stories, sharing your insights, sharing the public health palettes, how you came up with the name. I'm very, very thoroughly happy I hear that today. So I'm really glad about that. I hope that JB has a really wonderful wedding as well. I hope to see some pictures. I don't know if you're going to post some public health palette, but just throwing it out there. We love to see some pictures. Um,
Great.
awesome.
Thank you so much for having us.
Yes, thank you.
Truly, truly my pleasure. So truly, truly my pleasure. So some housekeeping items, everyone. Thank you so much for joining us today and listening to this episode. Make sure to subscribe, to like, to share this with a friend. I appreciate you all. If you want to support the channel, you can go to buymeacoffee.com/, the PH Millennial, and you can support me there. If not, I guess I'll see, or you all will see me next week. Have a great one, everyone.
Yay, bye.
Thank you.